It is nice to see everyone joining us. I'm going to let the numbers climb a little higher. All right, good afternoon, everyone. Welcome to our release webinar for Supporting Diverse Family Caregivers, a guide for patient advocacy groups. My name is Lauren Tokarwich, and I'm the Senior Manager of Special Projects at the National Alliance for Caregiving, as well as the project manager on this guide. If you have any questions or comments throughout this presentation, please submit them in the Q&A box, as we will have time at the end of the webinar to answer them. Supporting Diverse Family Caregivers is a guide that was created to assist patient advocacy groups in reaching diverse family caregivers and providing them with culturally responsive supports, resources, and information. We know from Caregiving in the US 2020 that of the 53 million family caregivers in the United States, 17% identify as Hispanic or Latino, 14% identify as African American or Black, 8% identify as LGBTQ+, and 5% identify as Asian American or Pacific Islander. The Centers for Disease Control and Prevention finds that 1 in every 4 American Indian and Alaska Native adults identify as a family caregiver. These numbers continue to grow, making it imperative that we address these family caregivers' cultural needs and provide them with appropriate support. The advice found in this guide is largely informed by research conducted with diverse family caregivers and patient advocacy groups in the condition areas of lung cancer, heart disease, blood cancer, and lupus. However, the advice is not specific to these conditions and can be used by any patient advocacy group. Our aim is that all patient advocacy groups will find this guide invaluable and keep these findings in mind as they continue to shape their outreach, resources, and interactions with diverse family caregivers. We also hope that others from the healthcare system will benefit from this guide as well. I'd like to thank our funder, AstraZeneca, for making this guide possible, as well as the multiple patient advocacy groups and family caregivers who shared their time, expertise, and stories with us. I'd now like to introduce Jason Resendez as our next speaker. Jason is the president and CEO of the National Alliance for Caregiving, where he leads research, policy, and innovation initiatives to build health, wealth, and equity for America's 53 million family caregivers. He is a nationally recognized expert on family care, aging, and the science of inclusion in research. Prior to joining NAC, Jason was the founding executive director of the Us Against Alzheimer's Center for Brain Health Equity, where he pioneered the concept of brain health equity through peer-reviewed research, public health partnerships, and public policy. In 2020, he was named one of America's top influencers in aging by PBS's Next Avenue, alongside Michael J. Fox and Surgeon General Dr. Vivek Murthy. Jason has advised federal agencies and organizations working to advance equity for communities of color, including the National Institute on Aging, the National Academies of Medicine, the Administration for Community Living, and the Congressional Hispanic Caucus Institute. Jason, I'll let you take it away.
Thank you so much, Lauren, for that introduction and for all the work that you've put into this guide. And thank you all for joining us to launch this new resource for patient advocacy groups. Supporting Diverse Family Caregivers, a guide for patient advocacy groups, is part of NAC's efforts to build equity in family caregiving. This is a personal issue for me. I grew up watching my mom balance a full-time job while raising 3 kids and taking care of my grandmother who faced multiple health challenges, a dynamic all too familiar in Latino households. It was tough work that she performed out of love and out of necessity. It was work that was made harder by the inequities she faced along the way as a Latina sandwich caregiver. These experiences shaped my perspectives on caregiving, the care injustices that too many among us face, especially women of color, and the urgent need for action. That's why I've committed the National Alliance for Caregiving to champion initiatives to build health, wealth, and equity for America's 53 million family caregivers. For decades, we've been a leader in leveraging our research to shine a light on the inequities minoritized caregivers face. Thanks to our research, Caregiving in the US, we know that Latino and Black caregivers are more likely to be in high-intensity care situations than non-Hispanic white caregivers. We know that LGBTQ caregivers are more likely to report financial strain due to caregiving than non-LGBT caregivers. And we know that Asian American caregivers are less likely to receive information from their healthcare providers compared to non-Hispanic white caregivers. And we're not done. We're committed to building on this work to build equity and address the gaps we see. One example is improving our efforts to collect and disaggregate data on caregivers to improve the development of policies and interventions to meet the culturally diverse needs of family caregivers. This is a must for us and the wider field of caregiving. Our research, the oral histories we developed for this guide, and the eye-opening fact sheets contributed by our partner, the Diverse Elders Coalition, tell us that minoritized caregivers often face serious inequities in the healthcare system as they care for their loved ones. Those experiences have consequences. They can result in health stresses, financial pressures, and emotional anxiety for the caregiver, and often lead to poor outcomes for their loved ones receiving care. Patient advocacy groups can be powerful partners in ensuring that diverse caregivers are heard, supported, and treated with the respect and dignity they deserve from the healthcare system. This guide offers a tool to help in doing just that. It's my hope that our partners will take these learnings and create best practices to reach and serve diverse family caregivers who are increasingly making up the ranks of our informal caregiving workforce. It's simple. Caregiving impacts all of us, but it doesn't impact us all equally. So this work is necessary and it's urgent. And I thank you for your partnership and joining us today, and most importantly, for the work that you'll do putting this guide into action. And I also want to thank all of the caregivers who provided insights into this work, to our sponsor, AstraZeneca, and to leaders who are putting this work into action every day, like Parvi Vaught, who you'll hear from later today. Back over to you, Lauren. And Lauren, you're on mute.
Thank you, Jason. It's now my pleasure to introduce Allison Dye. Allison is the Director of Oncology, Advocacy, and Alliance at AstraZeneca. In this role, Allison works to create long-term strategic partnerships with advocacy organizations focused on collaborations that help patients and caregivers to achieve the best possible health outcome and overall support. Allison has been with AstraZeneca since 2019, where she has led advocacy across oncology, including pan and pediatric, liver, bladder, prostate, pancreatic, and hematologic cancers. Allison, I'll let you go now.
Thank you, Lauren, for the introduction. It's so exciting to be here with you all today. As we all know, caregivers play a unique role in the care paradigm, and each experience is different. When someone's loved one is diagnosed with something, it can be overwhelming and challenging, the experience just to navigate care, especially when facing cultural differences that lead to challenges and inequity, like Jason just mentioned. And as we see the number of diverse family caregivers increase, it's more important than ever to provide culturally responsive support that meets caregivers where they are and supports them every step of the way. AstraZeneca is proud to sponsor with NAC the numerous advocacy partners and the caregivers who were involved into bringing this guide to life. Caregiving is no easy task, and this guide is a critical resource for advocacy groups to support caregivers. Today's webinar and this guide is another example of what we can accomplish together. I look forward to hearing more from everyone here today. And with that, Lauren, I'll turn it back to you.
Thank you, Allison. As I mentioned earlier, this work could not have been done without the family caregivers who shared their stories with us. I'd now like to introduce you all to Parvi Vaught, who was one of the caregivers we met with in the series of oral histories we conducted for this project. Parvi is a second-generation Indian immigrant, healthcare executive, and board director/advisor on global and national nonprofit foundations and councils. She is a results-oriented leader with a rich set of multi-sectoral experiences across U.S. government, global nonprofits, and 3 commercial industries: pharmaceutical, retail apparel, and medical technology. Parvi is known for her sharp eye on stakeholder value when creating and executing purpose-driven strategies that deliver scalable outcomes. She's known for building cross-cultural global teams and optimizing enabling functions to anchor organizations' ability to accelerate its capacity when facing uncertainty caused by external social pressures. Corvi is trained in health systems and economics with a BA in neuroscience from Northwestern University, an MPH from Yale University, and a PhD ABD from Johns Hopkins University. As an advocate for caregiving, loss, and bereavement, Corvi uses her lived experience and her health systems and leadership expertise to help ensure greater inclusion of women of color and immigrants in strategies that enable health and care at home for the elderly. She is a board advisor and board executive for the Rosalind Carter Institute for Caregivers, Caring Bridge, Women in Global Health, Women Lift Health, and National Service Office of Nurse Family Partnership, as well as Asian Americans in Philanthropy and Angel Island Immigration Station Foundation. Corvi, I'll let you go ahead.
Thank you. Well, first of all, thank you for including us in this conversation, and for all of you for the work that you do and what you're going to be doing to help us move this this agenda forward. You know, as you heard that long bio, it took me a minute to add the last bit, which is a bio that I think all of us share, is some form of caregiving that we're inside of. And many times we don't realize that we are one until you're in deep. So a little bit about my story. You heard that I'm a second generation Asian immigrant, Indian American immigrant. My parents came pre-Civil Rights, pre-Immigration Act, and came without knowing anyone in this country. I'm an only child, and that's because of a variety of health issues that my mother faced. And my father had early onset dementia, which frankly, now that we all know what's happening with Bruce Willis, was exactly the same kind of dementia that Bruce Willis had. So he had it early, because we see that that does happen early, and he had it at 58, which meant I was 28. And you can imagine, because we can all put ourselves in the seat of a 28-year-old, what kinds of life decisions that we're trying to make at that time, and what happens when you now need to take care of your parent. And so much of what caregiving is about is culturally determined. Care, loss, and bereavement are the most cultural expressions as they come to life in family and community. And so when I had to make these decisions, a lot of it was around how I pulled away from work. And you'll hear a lot of discussion about, you know, when we step in to provide care, we step away from work. And we do so, you know, often without support and certainly without reimbursement or pay. And that happens at every level. And paid leave and a lot of other things that are happening today are here to try and help square that off for us. But for me, one of the biggest issues I faced is that my parents, you know, we were the first wave of immigrants here for our family. We didn't see, I certainly didn't see my grandparents get older in front of me. I love Jason's story of just watching care move through, even with the pain. You actually were able to see care come to life. But we weren't able to see that. That was happening through letters and phone calls someplace else. And so this is a very new experience if you happen to be a first or second generation immigrant. We also know that Asian Americans is a hugely diverse group, and I represent South Asians. And this conversation is just the beginning of trying to isolate what's happening with the South Asian community. But what's very clear is that as care came home, I needed to provide care for my mom at home over the pandemic, and she recently passed away last year, all the way through to the end of life. It took a lot for me to decide to stop working, and that took a lot of coaching and effort because of a lot of family norms as well. But the cultural approach to all of this led to some big decisions. I didn't get married. I didn't have children. My dependents quickly became my parents. In our culture, oftentimes a girl moves from her parents to her in-laws, and that was a very difficult Sophie's choice decision that I could not make. And that changed a lot of what that would mean for me. It meant now I have to figure out my own retirement, my own income, my own health insurance because of the decisions that I had to make to stay home. When we did have care at home, it was also very clear who was providing care for us at home. And many of the women who were providing care either looked like me or another shade of brown or black like me. And it became so clear that here we were, a community of women that are taking care of people at home, some with resources, some without, and our story not being told. That's where patient advocacy groups, that's where advocacy groups in general come in to help change the system around us. Two things that were really an issue for us that became very tactical. When you think about Medicare Advantage and a lot of the things that services that might be provided when a loved one comes home, Many of those services are not culturally adapted. A key one is food. When it was time to come home, and a lot of these services were going to bring food home, they were not customized for a vegetarian diet, let alone a Hindu diet, let alone an Asian palate. So here I thought I would have all this help, but at the end of the day, I still had to figure out how to cook and get things done for my mom alongside everything else. As you move closer to end of life and bereavement, it comes again around the cultural and religious things that are necessary that help us cope with end of life. Many of hospice providers and the rest are not necessarily up to speed yet, in depth or with comfort within our families to be able to convey what's necessary from a non-Christian perspective. And when that's happening, again, that starts to isolate us even further. So the advocacy that's necessary is to bring voice to this, to bring comfort around what happens when care comes home, and to really recognize that we tend to isolate during times of care and grief. And this is an opportunity to use advocacy, which is all about coming together to bring that voice into this so that we can bring this out into the light and ensure that the experiences that we need, the services that we need are actually integrated with the kinds of things that different cultures require. And my hope is when we move further into further research in this area, into further advocacy in this area, that we disaggregate a bit further, and then we'll go, this is the beginning of going further on what can we do with South Asian groups, with Indian American groups. And for us, and I'll say it for myself, I've been an executive in healthcare. The biggest moral imperative is to now realize that we're actually patients and families in the systems that we're actually making decisions about during our day job. And I'll admit, I didn't bring all of that personal experience into my decision making. And I happen to be of a community that does have a lot of influence in the healthcare arena. So that's the other piece of advocacy and voice and research, is how are we going to change these systems and use our voice even as we're going through our work and being family members, if we happen to be in the room already, to be much more open, vulnerable, and comfortable in doing it. So really thank you, Lauren, for the work that you put here to allow us time and have voice, and Jason for all the work that you've done. And please reach out. We are looking for more and more opportunity to bring the right kind of voices in the right kind of rooms, and I'll do my best to do my part. So with that, I'll turn it back to you, Lauren.
Thank you so much. Thank you for being a part of this project and for sharing your story and your experience and your insights. They've been incredibly invaluable to everything. So thank you. We will now move on to introducing you to the guide and the process of creating the guide. This is a reminder that if you have any questions, please put them in the question box, and there will be time at the end of the webinar for us to answer them. So I'd now like to introduce Dr. Cawthron, and I'll be handing over to her to explain the research. Dr. Cawthron is the Hunt Research Director at the National Alliance for Caregiving. Dr. Cawthron is a nurse scientist and a board-certified gerontological clinical nurse specialist. Prior to joining the National Alliance for Caregiving, Dr. Cawthron was a faculty member with the Family Caregiving Institute in the Betty Irene Moore School of Nursing, University of California, Davis, and Rush University College of Nursing in Chicago, Illinois. Dr. Cawthron brings 15+ years of experience in dementia family caregiving research and related activities, where her work has focused on health equity and the health of African American dementia family caregivers, including most recently, caregiving stress and resilience. Dr. Cawthron will help elevate national family caregiving research by designing and managing NAC research initiatives, including Caregiving in the US 2025. Dr. Cawthron's prior work as Alzheimer's disease and related dementia project lead for an HRSA-funded geriatric workforce enhancement program, and experience as co-lead of the UC Davis Alzheimer's Disease Research Center's Outreach, Recruitment, and Engagement Core translate to leading a peer-to-peer network of national and international experts and representing NAC in public meetings and professional research forums. Dr. Cawthron earned a Bachelor of Science in Nursing from Howard University in Washington, D.C. She completed a Master of Science in Nursing with an emphasis in gerontological nursing and a Doctor of Philosophy, both from the University of Michigan, Ann Arbor. She also completed a Claire M. Fagan postdoctoral fellowship with the National Hartford Centers of Gerontological Nursing Excellence. She is a Fellow of the Gerontological Society of America, a member of the National Black Nurses Association, and a distinguished educator in gerontological nursing education. Dr. Cawthron, I'll now let you go ahead.
Thank you. And I'll just share my thanks for everyone for joining as well. I'll go ahead and, as Lauren mentioned, just share a research overview of how this work was done. Next slide, please. The purposes of this work were to gather feedback on the challenges caregivers faced when identifying, accessing, and understanding resources as caregivers of a culturally diverse group, and to determine the supports and services that could improve diverse caregiver experiences, as well as how patient advocacy groups could better support diverse caregivers. Next slide, please. Before I share what we learned from caregivers, we also spoke with patient advocacy group representatives to get a sense of what they were currently doing to support diverse caregivers. With this slide, I want to highlight that overall patient advocacy groups have a commitment to the work of supporting and seeing diverse caregivers. They recognize areas to improve with changes already underway. They view this work as an important opportunity to learn with and from one another. And they also acknowledge the very real barriers such as funding and organizational limitations while still thinking creatively to continue their efforts. Next slide, please. So on to the approach that we took to do this work, which included we conducted online, individual, in-depth interviews with diverse caregivers across a variety of conditions, as Lauren had mentioned earlier. Diverse caregivers were identified as African American or Black, Asian American and Pacific Islander, Hispanic and Latino, and LGBTQ+. Next slide, please. We had a total sample of 29 caregivers who participated in interviews. Most caregivers were between the ages of 35 to 49. They were caring for someone aged 65 years or older, with more than half of those caring for a parent, parent-in-law, or step-parent. The majority of caregivers also self-identified as African American Black, as women, as heterosexual, and were caring for someone with heart failure. Next slide, please. The majority of caregivers lived with the person they were caring for. They were located in the South, had completed college. They had an annual income between $50,000 and $99,000, and a slightly higher majority have been caregiving for 3 years or more. Next slide, please. Now, as we move into the crux of what we learned from diverse caregivers, cultural traditions and values have a significant impact on the caregiving journey. Most diverse caregivers do not want to burden others with their own needs, with caregiving being seen as a responsibility and a duty. Caregivers are traditionally female, growing up seeing family taking care of one another. So caregiving is natural. In addition, most diverse caregivers would never consider long-term care placement for their elders, and some diverse caregivers, as well as those they care for, are very private about illness. Next slide, please. Race, ethnicity, and sexual orientation were not found to have a significant impact on the caregiving experience, although there were isolated incidents of bias. Some examples shared included making assumptions that the caregiver does not understand English, being provided the bare minimum of information as if they would not understand anything more, and not being taken seriously, specifically as a young caregiver, a male caregiver, or a disabled caregiver. Next slide, please. Although resources are available and accessible on the internet, it is difficult and overwhelming for caregivers to find them. For example, caregivers highlighted that it can be hard to find the good resources and having to dig through everything that's actually available. Caregivers feel as if they're on their own with only the internet available to them, and that resources are mostly for those caring for older adults. Next slide, please. Patient advocacy groups are not a go-to resource for caregivers. Caregivers were either not aware that patient advocacy groups existed or that they were even available to caregivers. Caregivers are overwhelmed and often do not have time to reach out to patient advocacy groups. Additionally, privacy concerns may stop caregivers from reaching out to groups. However, caregivers would like to learn about patient advocacy groups, especially through trusted medical professionals. Next slide, please. Now, we learned about some preferences of resources, and they fall into 3 general areas. In terms of format, caregivers prefer chat forums with peers, interactive resources, apps and downloadable materials, printouts that they can take home after appointments, podcasts or videos, and easily digestible information. Another area is cultural sensitivity of resources, which include images of people who may look like them, resources that consider culture, and acknowledgement of culture to set the expectations up front. The last area are resources caregivers would like to see, such as comprehensive apps, real-time advice with healthcare professionals, resources in other languages or translation services, healthcare education, advice, tips, and tricks, as well as caregiver respite. Next slide, please. Some ways that patient advocacy groups can better support diverse caregivers include increase awareness and familiarity with diverse communities, increase cultural sensitivity, provide basic information on healthcare and education, emphasize diversity, equity, and inclusion, create resources and education specifically designed to support caregivers, connect caregivers to other caregivers, provide large communities of support, and finally, be easily accessible and open to help. Now that I've given you that overview, again, thank you, and I'll turn it back over to you, Lauren. Thank you.
Thank you, Dr. Cothran. I will now walk everyone through the broad contents of the guide so that there's more understanding of what's included. I wanted to once again thank AstraZeneca for their funding and support in the creation of this guide. I also wanted to acknowledge the patient advocacy groups who were on the expert committee for this guide and lent us their expertise and insight throughout the project. These groups include the National Lung Cancer Roundtable at the American Cancer Society, Be the Match, Cancer Support Community, Go-To for Lung Cancer, Harboring Hearts, Lymphoma Research Foundation, Longevity, National LGBT Cancer Network, and SAGE. Now to get into the contents of the guide itself. At the beginning of the guide, you'll find fact sheets created by the Diverse Elders Coalition for their own toolkit for healthcare providers called Caring for Those Who Care. The Diverse Elders Coalition is doing extremely important work to learn about the needs of diverse family caregivers and have created a comprehensive set of fact sheets with statistics and findings based on their own research. They have graciously granted us permission to use them in our guide so that those who read it can benefit from these findings as well. The DEC fact sheets include information on African American and Black, American Indian and Alaska Native, Chinese and Korean American, Southeast Asian American, Hispanic and Latino, and LGBTQ+ family caregivers. And they are continuing their research into further populations of family caregivers in the country. These fact sheets provide a basic understanding of a caregiver's experience based on their race, ethnicity, identity, and culture. The guide then also includes an infographic that will be a summary of the information and the findings that Dr. Cothran just went over. And then it'll move into information and recommendations that we heard from the family caregivers involved in our research and our oral histories, which I'll just briefly go over once again. So we had this first section that was on what we heard from these family caregivers, and they let us know how, when, and where they could be reached by patient advocacy groups. So some of these examples were how, by creating short, simple messages that would get their attention and would be easy to understand. To emphasize services for the caregiver and to kind of define what a caregiver is, because that can be different across each individual and across cultures. So just emphasizing that there are supports and services by a patient advocacy group available to the caregiver will make them more aware that they are there for them. Genuine equity and inclusion by groups. So just showing that you are doing the work with cultural sensitivity. And then working with healthcare providers. So patient advocacy groups working with healthcare providers themselves would be a good way for them to reach family caregivers. When was also different by each individual because everybody's experience is different and everybody processes information and emotions differently. But some of the examples we were given by caregivers was at the time of diagnosis. Even caregivers who said they were overwhelmed at the time of diagnosis still wanted some information about groups that they could look at later when they had the time. During a doctor's appointment, because again, that's where a caregiver was spending a lot of their time as a caregiver. So it was easiest to get this information at a doctor's appointment. When a caregiver is searching for information, so that just means trying to be one of the first few results in a Google search or being easily accessible in some sort of way to the caregiver when they are looking for that information. And then throughout the pathway of their care journey, which means providing caregivers information they need at the time that is relevant to the time in the journey that they are at. So a caregiver who has just started caring for somebody may want more information on the condition that they're caring for, but a caregiver 3 years down the line may not necessarily want those resources and may want information about respite or even possibly palliative care. And then where they could find diverse family caregivers and reach them is the big one. The big answer that everybody gave us was through a trusted medical professional. So caregivers thought the best way to find them and to reach them and to get them this information was through a doctor or a nurse or a social worker at a hospital. They said where the caregiver is in their everyday daily life. So places like, a community center, the library, church, that sort of thing. Social media and online, which is the big way to reach people these days. And then some caregivers expressed the desire, as Dr. Cothran said, for an available app or texting service where they could be reached. We also heard from caregivers on the resources they'd like to see from patient advocacy groups, and these included support groups with other caregivers, either from the condition that they're caring for or from their cultural background, a real-time connection with a medical professional where they could get an answer quickly and ask questions in response, resources that were relevant to their cultural needs, a one-stop shop, and this just means that on a group's website, there may be a tab for caregivers where you could pull down and all of the resources that the group has available to caregivers is in that tab, so it's easily accessible. Resources that provide financial assistance, education on how to interact with the healthcare system, and easy to understand and translate resources. We also have a section on advocating for the caregiver. Through all our work at NAC, we know that caregivers end up becoming an advocate for themselves and or their care recipient at some point or another. Speaking with diverse family caregivers, it became clear that this was more so the case for them because they would have to advocate for cultural needs, or even sometimes in cases of bias or prejudice would have to advocate for medical needs. So this diagram is available in the guide, and it just shows what a unique position that patient advocacy groups are in as groups that are serving the patient, where they can also overlap with their needs with the caregiver, and patient advocacy groups can, kind of reach that area. And there's also some recommendations on how to help advocate for the family caregiver that are in line with the 2022 National Strategy to Support Family Caregivers included. And then the last section we have is on how patient advocacy groups can help empower the caregiver. So assisting them in caring for themselves. Some of the examples include helping to eradicate guilt that a caregiver might feel in caring for their own health. Sometimes caregivers feel that they shouldn't care for their own health over that of their care recipient. So helping them come to realize that they need to care for themselves as well is important. Which kind of goes into the next example, which is reminding them that they can't care for others if they're not in good health. This obviously isn't the only reason that they should be in good health. They should be in good health for themselves, but sometimes reminding them that they also need to be in good health to provide care helps with that guilt. Also, not assuming ability or privilege in the resources that are provided to family caregivers. Not all resources are available or accessible to everybody. So it's important to ask caregivers questions about what they need and what they are able to do in order to give them the correct resource. And then helping them navigate the mental health care system. And then we also included a section on helping reduce mental health stigma, which is very prevalent in all populations in this country. But education on mental health can be helpful in reducing stigma, just being open about mental health and about what can be done to address it. Connecting caregivers to someone from the same culture or background so they can speak to somebody else who understands what their cultural needs are, what they might have experienced in their life, and to talk to them about mental health and what they can do about it. Helping them in how to speak to family and friends about their feelings and their emotions and their caregiving experience. And then just the group in general being open about mental health and mental health awareness and normalizing talking about it and being open about it. And then finally, in this guide, we have a series of vignettes that were done with family caregivers. These were oral histories, and they're included as written vignettes in the guide itself. And they're also linked in the guide to our YouTube channel as video vignettes. And as the resident archivist and person who does the oral histories at NAC, I just want to say how important it is to me that we connect these personal experiences and stories and faces to the research and the findings that we provide. It just creates a personalized connection, and it really helps you, create that emotional bond with what we're learning, and it helps in all our efforts. So I'm actually going to share one of these oral histories with all of you, and then we can move on to questions. Let me just pull that up.
Most any time that we go for her care, I'm not addressed or anything like that. They might ask who I am, but in terms of resources or what this looks like for our family or anything like that, no, that's never occurred. It's my wife, and she has lupus along with some other diagnosis that goes along with lupus. And I've been caring for her or with her for about 10 years solidly. I think that, like high blood pressure, portions of lupus become so I can't think of the word, every day, that you just assume that everybody knows, for example, that you need to drink water when you're taking medication for high blood pressure. They just assume that you know that because they've had so many patients that they're treating for this, putting in that effort to call and say, hey, what do I do here? I don't know, you need to go do this or you need to go do that. It's starting to kind of fall off because it's just a lot of energy to try to get someone to assist us. I feel like Kimberly and I have both been very vocal in advocating for her, but it gets tiring. I think culturally, we've been brought up to take care of things at home. I don't know people that have lupus. I don't know. It's kind of like being by yourself. It wears you down to the point where you just, she just tries to get through. Unless it's something really, really bad, then she just, we just try to get through it. Even if it's a quarterly checkup, 4 times a year, have you done this? What are your numbers look like? Do you understand what your numbers look like? Do you understand that you're doing well when it's in this range or that kind of thing? For caregivers, like just in general, knowing when you need a break, knowing how to ask for that break, knowing how to set things up. I guess I should first start with not having a whole lot of trust in healthcare in general. I feel like, especially with Kimberly, that we have to continually advocate for any kind of, like for someone to take her symptoms seriously. It's not a whole lot of us that are these doctors, that are over these groups, these advocacy groups, that are in places where we can see them as employees, as members of the healthcare community, where we can see people, because when we see people that look like us doing what we do, then we trust that, right? So it's gonna be a complete overhaul. Listening and giving that information back and really following through as a human, not as a color.
Okay. So sorry that wasn't the smoothest it could be, but hopefully you got an idea of what they all look like. And like I said, those are available on the NAC YouTube channel, and which is National Alliance for Caregiving, and they're linked within the guide itself. So you can just follow the link from the guide. So I now want to open up the floor to any questions. I see that we already have some in the Q&A box, but feel free to add some more and we'll start answering those. So Sherry, like I just said, the videos are available on the National Alliance for Caregiving YouTube channel, and they are linked in the guide as well in that last section where the written vignettes are also located. I see people raising their hands. Hold on just a moment. Or maybe not. I thought I saw some raised hands. If you have questions, put them in that Q&A box. Oh, Dr. Catherine, go ahead. I see you. You're on mute.
Thank you for that reminder. Yes, someone had asked a question about the breakdown. And so the majority of folks were heart failure, but there were also folks who were caring for someone with lupus, someone caring for someone with lung cancer or blood cancer. But heart failure, I think the number was like 15, with the rest divided out across those other areas. So I hope that that was helpful. And I don't know that we have policy solutions right at this moment, but we're always moving towards action. So I will just say stay tuned for now.
And then Pat, I have a question for you if you're on.
I am.
All right. So I have, now that this guide is being disseminated, what are NAC's next steps?
Erica, could you be a little bit more specific about what you mean by next steps for this project or overall?
And then there are just a couple of questions about specific resources that may be in the guide. The guide was created to assist patient advocacy groups in reaching diverse family caregivers and providing those resources. So there are no specific resources included in this guide, but there is a resource list that links to patient advocacy groups and some other resources leading to resources.
Lauren, I'm going to answer Erica in the chat.
Okay,
Okay. Oh, so Fawn, actually, I'm going to turn it to you. So Erica's asking to know what our next steps will be for research.
Yeah, so one thing I can say that has been alluded to earlier in introductions from our CEO and as well as from Parvi is that we are, Porvi, excuse me, I didn't mean to do that. But anyway, one of the things that we're very conscientious of is moving forward, we really want to make sure that we're disaggregating data. And so, recognizing that the experiences of diverse caregivers are going to be very different and their needs are going to be different. And we want to draw attention. We want to be able to pay attention to those pieces. That's one piece that we're doing as we move forward with our next steps in the terms of research that we're doing.
So somebody just asked for a link to the guide. I'll put that in response. Kosua, can you type your question? I don't think I can bring you on. So Jerry said many of these. Go ahead, Pat.
Sorry. So we do have a question asking what the best way to receive one of the resource guides. So if you go onto our website, Lauren will put the link in this chat box, but it's also available through our website. Lauren, if you want to put the link into our website, that would be great too, www.caregiving.org.
Yes.
And then it will be distributed as well to patient advocacy groups directly through our expert committee. And we have a question from Jerry about health literacy, communication issues, and sorry, my scroll down. And then family caregiver not identified in the medical records. So those are all things that our advocacy team is aware of, and particularly with regarding the family caregiver not being identified in the medical record. Giving family caregivers greater access to the healthcare system is one of our priorities and pillars going forward as we begin to shape our advocacy work and the work that we do through our innovation programs. So we'll continue to look at it, and it is something that we plan action around.
Then Fawn, do you think our findings would have been different if the subjects had been less educated with lower income?
Yeah, thank you for that question. I wouldn't make the statement that yes, they would, but I certainly would be interested to know what the findings would have revealed if we did have, more of a diversity of income and education levels. I mean, we did have a range, but because the majority did have, like you said, higher income and had a higher education, one would wonder what that would look like. Literature does show that sometimes those experiences look different for caregivers, but yes, I'd be interested to see what it would look like. I see a question about the app being developed. And I personally am not sure. I know apps are always in development for a variety of reasons, and a variety of companies and organizations are doing them, but I don't know that there's actually been one for diverse caregivers in particular.
Yeah, I was going to say, I'm not aware of one either, but then I haven't been looking for one. So there may be, but right. But the findings speak to caregivers not knowing about it if there is one. So that's an issue.
Great question about the percentage being first generation immigrants. We don't have that kind of breakdown, but that would be a very interesting, that would be some interesting insights. But thank you for that. And then non-English, non-Spanish speaking caregivers and resources for Middle Eastern communities. Again, great questions, great points. Again, one of the things that we are trying to do in the work that we are doing is really making sure that we try to reach communities who don't speak English as a first language. The work that we did for this work does not actually reflect that in terms of data for non-English speakers, but we are aware that that is a major gap that we want to at least be mindful of. And then I don't remember if there were resources for Middle Eastern communities in the resource guide, but I think that's a really important point, and I thank you for raising it. And Lauren, just in case you might know of anything that was listed, I just don't recall seeing that.
I don't believe specifically. The only place where we had, I guess, resources or statistics is the DEC fact sheets.
And I don't think that they had Middle Eastern, but
no, but they are continuing their research as well. So the Diverse Elders Coalition is also an organization to watch for these findings and this research. They're doing a lot of really important work there.
Okay. Yes, folks who speak English as a second language or have limited English proficiency do have multiple barriers to healthcare. So again, thank you for raising that issue. And then it looks like Lauren is answering that next question. Thank you, Sherry, for your question. I'm seeing unique caregiver needs if they were discussed by caregivers of people with physical disabilities. That did not come out in this work, but I know that let me be careful as I say that. That did not come out in this work, but we do know that the different types of caregiving require different types of care and intensity of care. And some of that work is in our Caregiving in the US 2020 report, but that did not come out in this specific work. But you raise a good point. Those types of needs and the intensity of care do differ based on the physical needs of the person that is receiving care.
We will be sending out a recording of this, and I can send out the slides as well for that question being asked. And as long as you are registered, you'll get that. So Veronica, I'll copy your email now, so I send it to you too. Fawn, I have, is there a recommended best practice for cultural competence?
Yeah, I think with this particular guide, I think that the starting point is some of the resources the Diverse Elders Coalition has started to begin moving along that trajectory. But I think that continuing to educate about the different cultures and different needs is certainly one piece. But again, some of the recommendations or some of the information that's included in the guide offers a first step.
Okay, it looks like we've cleared the question board. I'll give another minute to see if anybody else has a question. Otherwise, we're about 5 minutes from the hour, so I'm happy to let everybody go. All right. Yes, Molly, the fact sheets are in the guide itself, and that link is in the chat box. And I think it's been put up a couple of times in the QR box or the question and answer box. And if you go to our website, www.caregiving.org, there's a banner at the top that will link to the guide right away. All right. Thank you, everybody, for joining us. I hope you have a good rest of your week. And stay warm if it's warm where you are or cold where you are. Otherwise, enjoy the nice weather. Have a good day.